go ahead and get started today. Welcome to the Gallatin County COVID-19 press call. Today we have Lori Christenson, our Gallatin City County Health Officer, Kallie Kujawa from Bozeman Health COVID-19 Incident Command Lead, and I also have Michael Becker, who's the News Service Director at Montana State University. So I'll hand it over to Lori.
Great, thank you, Holly. Again, my name is Lori Christenson. I'm the Health Officer for the Gallatin City County Health Department. Thanks for joining us today. So I'm going to start with our weekly surveillance reports, and then I'll have a few other updates as well. Okay, so in terms of our daily 7-day average COVID-19 cases per 100,000, we have seen an increase from our previous week. And what I want to note here is that this peak, or this, I would say this, where we are currently in our epidemiology curve, does match where we were in that first week of January. So I just wanted to add in that relationship. Last week I had said that we had exceeded our April peak, and we are now matching what we are seeing in our epi curve last January, or this past January. In terms of our daily and 7-day average percent positive, we have seen a slight decrease in our positivity rate, still above the red line, which is indicated of 10% positivity rate. Our median test turnaround time and reporting to public health remains 1 day. And I want to spend a little time on some additional figures we have added to our surveillance report. So this first figure describes the number of cases by vaccination status by the CDC's MMWR week from January 1st to September 18th. So the light blue bars here represent weekly case counts among fully vaccinated. So the blue is fully vaccinated Gallatin County residents, and the orange bar represents weekly case counts among unvaccinated Gallatin County residents. And so what's important to note here is that we are seeing a rise in our cases. It's not unusual then to see a rise in breakthrough cases. And then what I also want to share is that we're still seeing about 1 in 4 cases be a breakthrough case. So I wanted to share that with all of you. In addition, we also created a new figure. This figure describes the number of hospitalized COVID-19 cases by vaccination status, again by the MMWR week. The light blue bar represents weekly hospitalization counts among fully vaccinated. Remember, this is Gallatin County residents, and the orange bar represents weekly hospitalization counts among unvaccinated Gallatin County residents. And the takeaway here is that what we have shared in the past, what Bozeman Health providers have shared in the past, is that a majority or most of those hospitalized tend to be among those who are unvaccinated. And wanted to also point out, Gallatin County has reached 60% of fully vaccinated. And I also wanted to share that we continue to see additional people receiving a first and second dose. So that is good news, and we continue to want to see that upward trend. Again, these are our school figure number, our school cases, our active cases, and then we continue to remain in high transmission. So I'm going to stop share, and I'm going to transition to a couple of other items I wanted to share with you today. So bear with me as we share a new screen. Okay, so hold on one second. Holly, can you see the PowerPoint slide that starts with COVID-19 Montana activity?
Yeah, but we see your note slides, not the presentation slide. If that helps.
It helps. Can I change it is the question. As you'd think that after all this time. Okay, is that better?
Yeah, there you go.
Thank you. All right, I appreciate your patience, everyone. So we have been receiving questions regarding the vaccination status of those who've recently reported COVID-19 deaths. And it's a good question. And I'll say, fortunately, few Gallatin County residents have died to or died as a result of COVID-19 at this time. So at this time, we will not be releasing vaccination status of those who have died. And we've shared that most recently as of yesterday in our previous release of information related to COVID-19 deaths. However, I do believe it is important for the community to have an understanding of vaccine effectiveness and the protection that it affords. So that understanding cannot be gleaned from this small, and I'll emphasize it, yet important number of deaths and the lives that they represent here in our community, just looking at our local data alone. So it is best to use the state and national death data to consider vaccine effectiveness. So here I've shared, and you can find this in the DPHHS weekly COVID-19 update, and I've linked that source here for all of you as well. Based on vaccination status of COVID-19 deaths in Montana from April 1st to September 17th, there were a total of 269 deaths reported. Among those, 79% were unvaccinated and 21% were vaccinated or considered a breakthrough. So I understand the importance of these data because I do believe they help understand vaccine effectiveness in our community. The vaccine remains effective in terms of protecting against hospitalization and severe outcomes, including death. The next slide I wanted to share with you as well is related to Gallatin County school data. We have been getting questions related to masks and the effectiveness of masks in those settings. So among K through 12 schools with at least one positive case in Sarah Alert, which is a system that we use to both communicate and collect information related to close contacts and isolation, those who need to be isolated, between September 18th, 2021 and September 22nd, 2021. These are the data from that time frame. And these are cases. This is a cumulative count of cases. And so what this really does depict is that the connection between wearing a mask and lower cases holds in this situation. Where there is a mask requirement, we are seeing there are fewer cases in those situations or in those school settings. So a couple of really quick notes I want to just confirm. This is cumulative cases. These data are from school enrollment data, is based on the spring of 2021 OPI data. And I also want to note that school cases do not mean the case became ill while at school. So there may not have been an exposure at school, but we still count them in that school total. And excluded cases with dates of birth earlier than 2003. And then again, that school mask information is based on personal communications we've had with schools. And of course, it's subject to change. And the mask status is based on mask requirements at the start of the school year. And also finally, that these data do not reflect staff. These are just students. So with that, I will turn it over to Kallie to talk about other updates related to Bozeman Health and our efforts for booster doses in the future.
Great, thank you so much, Lori. And for those of you who don't know me, I think I'm acquainted with most of you, but for those of you who don't know me, I'm Kallie Kujawa. I'm Bozeman Health System Director of Quality and Safety, as well as the long withstanding Incident Command Lead. Thank you so much for joining us today. We currently have 27 COVID-19 positive hospitalized patients at Deaconess Hospital. We do not have any COVID-19 positive patients at Big Sky Medical Center. Our critical care unit at Deaconess Hospital has 20 beds and is currently at 100% capacity. 10 of the 20 in the ICU are COVID positive, with the remainder being other healthcare needs. Additionally, our medical unit is at 100% capacity as well. 17 of the 39 patients are COVID-19 positive, and our surgical unit is at 100% capacity as well. While we are still having very high numbers of hospitalized COVID-19 patients, we remain providing conventional, or what is known as normal standards of care. I do want to remind the community, and we are also preparing for additional visitor restrictions, and we will no longer allow visitors unless they are necessary for care delivery or emotional support. Exceptions to our no visitor policy include a patient facing end of life, a pediatric patient, a patient in a behavioral health situation or needing emotional support, and a patient coming in for an obstetric visit or obstetric ultrasound. We know that this is extremely difficult, and we appreciate everyone's understanding as we work to help keep our patients, our staff, and our community safe and healthy. Switching gears just a little bit, we know because it was released today at cdc.gov that the CDC director, Dr. Rochelle Walensky, endorsed the CDC Advisory Committee on Immunization Practices, or what's known as ACIP, recommendation for a booster shot of the Pfizer-BioNTech COVID-19 vaccine in certain populations, and also recommended, on top of that, a booster dose for those in high-risk occupational and institutional settings. The Food and Drug Administration's authorization and the CDC's guidance for use are important steps forward, and we want to, as we work to stay ahead of the virus and keep our entire community safe. The specific recommendations, and remember this is only for Pfizer-BioNTech, but the specific recommendations from the CDC for administering boosters are for people 65 years and older and residents in long-term care settings, that they should receive a booster shot of Pfizer-BioNTech vaccine at least 6 months after their primary series has been completed, which is a series of 2 doses. People aged 50 to 64 years with underlying medical conditions should receive a booster shot of Pfizer vaccine at least 6 months after their primary series. People aged 18 to 49 years with underlying medical conditions may receive a booster shot at least 6 months after their Pfizer-BioNTech primary series based on their individual benefits and risks. And people aged 18 to 64 years who are at increased risk for COVID-19 exposure and transition because of occupational or institutional settings may receive a booster shot of Pfizer-BioNTech COVID-19 vaccine at least 6 months after their primary series based on their individual benefits and risks. The CDC has not advised upon or released any guidance on boosters for other COVID-19 vaccine manufacturers, to include Moderna or Johnson & Johnson. We anticipate receiving guidance on boosters for those manufacturers in the coming weeks. Bozeman Health, as we have worked so well and partnered with the Gallatin City County Health Department, has once again partnered up to host massive immunization clinics on Bozeman Health's Deaconess Hospital campus in the main hospital lobby at entrance 1. And that starts this Monday. Booster vaccine appointments will be available on healthygallatin.org, and we encourage folks to use that scheduling platform that's available on healthygallatin.org to select a time that works best for them. For questions about scheduling your first, second, or third dose, in the event that you are unable to use the website to register for your third dose of vaccine, please contact either the Bozeman Health COVID hotline at 414-2619 or the City County Health Department call center at 548-0123. Please remember, and I'll reiterate, the third dose or the booster dose guidance from the CDC is only for the Pfizer BioNTech vaccines and those who have received that particular vaccine as part of their regimen. There will be more to come from the CDC on recommendations on booster doses for the other manufacturers such as Moderna and Johnson & Johnson. And we will absolutely update you as we learn more from that. Switching gears yet again, on behalf of all of Bozeman Health and all of our employees, we want to express our gratitude for all those who have contributed monetary funds to our COVID-19 Compassion Fund, which now totals more than $8,500. We're blown away and we are so very much appreciative of the support. We are also incredibly thankful to all those who have brought meals, snacks, and coffee and drinks for our staff. A few I'd like to mention are Granny's Donuts, Ryan LaFoley with LaFoley Kitchen, Treeline Coffee, Lairkines, Roxy's, Pat and Susan Ellis, Wild Crumb, Jenna Moran, 360 Office Solutions, YCCF, and Charles Schwab. Please note that any measure of support, a sign, a letter, or a card, a positive comment on social media are all incredibly important to us, and we appreciate every one of them. Thanks so much for your support, and I'll kick it back to Lori here.
Thanks, Kallie. Let's go to Michael for any MSU updates.
I don't have any major updates today, but I am available for questions if any are directed toward me. Thank you.
Okay, so at this time, we'll go ahead and open it up to questions from all of you.
Hi guys, I had some questions. Sorry, I jumped in a line. Lori, I have one for you. Could you just kind of explain a little bit more as why locally you're not releasing vaccination status for those who have died? You kind of touched on it, but I was looking for, for that explanation.
So the question was why Gallatin City County Health Department is not releasing the status of vaccination for those who have died.
Yeah.
So out of respect for the families, we're not releasing any additional information. And I also mentioned that it's important to look at the state trends as it relates to and understanding the vaccine effectiveness, because I think that's really the question that people have is how safe is the vaccine? How effective is the vaccine? So I wanted to make sure that everyone had those data available at the state that reflect those who have died and their vaccination status. Those data are more, I would say, I'll also just say that, we do have a small number. So one or two can significantly shift the number of what that reflection of their status, vaccination status. So I wanted to make sure that people had the resource available to them to understand the vaccine effectiveness by looking at those state data.
Awesome, thank you. And then I had one other question I've been kind of thinking about for a while. I know state laws kind of muddled how easily and quickly you can do this, but I was wondering if we reach a certain point or what that point would be where you consider presenting a mask mandate or other public health measures to the city or county commission? If that's something you're gonna, yeah.
Sure, and I mentioned this on the last call too, so thank you so much for this question. I think it's an important one because it is something that I am speaking to our board, our city, county, as well as our elected officials so that we can determine the best course of action. At this point in time, we do not have any plans to move forward with any additional local requirements.
Is there any kind of threshold, you know, certain case count or something like that, where you might begin to look at that?
No, Juliana, that we have not looked at that as a threshold. I think we continue to monitor what we're seeing in our community and are actively communicating with our hospital as well. And again, I want to just stress, and I think this is important to continue to note, that barring there's nothing stopping an individual from wearing a mask in an indoor setting voluntarily without a regulation in place. That is definitely always an option for our community. And I would strongly urge, as has been the recommendation for a number of months now, since we have been experiencing high transmission, that individuals should be wearing a mask in indoor public settings.
Cool, thank you. And then
Yes, thank you.
I just had a couple questions for Callie, and then I'll stop asking all the questions. Callie, this is actually a question I got from a reader about the 6 people that tested positive that you were talking about on Wednesday.
Mhm.
A couple people had asked if we had asked, which I don't think any reporters did, if you could share the vaccination status of those people. And I understand with the patients you might not be able to, but
Yeah, that's a good question. You know, we we protect the information of our staff just as much as we protect the information of our patients, and so I won't be sharing that information, but I can understand people's curiosity and wanting to know that information. But we equally protect the health information of our employees as well.
awesome. And then out of my own personal curiosity, for all those donations, are those all recent, especially the monetary donations? Is that within the last month or week or so?
Yeah, I might have Lauren answer that one. Lauren, do you know if the monetary information from our foundation was just recently, or is that combined last year, this year together?
Sure, great question. I will have to follow up on the total amount. I know that at least 3,000 of that was raised within the last week.
Thank you, Lauren. Juliana, I do want to add one more comment about knowing the vaccine status of the 6 involved last week. We do share some information on our patients' vaccine status. However, with such an isolated incident and in such a small space and a small community, at times it can be important to not share particular information, especially when it's easily linked back to a few individuals. So we kind of use our discretion as to when it's a need to know information and when it's a not need to know information, especially if people can make connections pretty clearly. So just to help out there in case my other answer was confusing.
Sure, I think that makes sense. It's good for people to know that. I had one other quick question I just remembered. I was curious, I know you've said in the past that it's about 80% of Bozeman health employees are vaccinated. And I forgot to ask this on Wednesday, but I'm wondering how you gather that. I mean, because isn't with Montana law, employees don't have to share your vaccination status?
Right. Yeah, so that 80% are the people that we know. that are vaccinated. The rest of the staff either have declined or have refrained from sharing their vaccine status with us. So that would be that other 20%.
So it's 80% voluntarily said that they were vaccinated.
Right, because the
Okay.
majority of them received that from our facility and checked a box that said they wanted to disclose that information. Mhm.
I see. Okay, that's good to know. I was
Yep.
wondering that the other day, like, oh, how did we figure that out? Those were my questions. Thank you, guys.
Yeah, and it's also important to remember that a lot of that information was gathered prior to that specific House bill. So most of that information was previously gathered as a requirement.
Cool. Thank you.
Mhm.
Go ahead,
Hey,
Noah.
Yeah, sorry. Just making sure everybody was done. I wanted to ask, and so I'm going to be kind of checking my numbers a little bit because I was looking at that COVID weekly surveillance report and it said there were 50 active COVID cases at MSU. And so I don't know if I can, I don't know if you can answer this, Lori, or maybe even Michael can chime in on this. I'm looking at the weekly report that comes out from the state, and there were 100 or so, I guess, not this last report, but the report before that was 59 total cases at MSU. And now it says 154 total cases just at Gallatin, Montana State University. And that's 95 new cases. And so I just would want to make sure, is that 50 correct on the active COVID cases as of right now?
Thanks for your question. I am not, which report are you referring to? You were referring to our surveillance report, and then you're comparing it to which other report?
Yeah, I'm just checking numbers. I want to make sure it was 50 active cases on the surveillance report. And then I'm looking at DPHHS, and they do a school-related COVID-19 cases in Montana. And so it has all of the county and the universities. And so I'm looking at the September 15th report, and then their latest one, which is September 22nd. And it said there were 95 new cases. So I don't know. I just wanted to, I guess, ask, it looks like there is a significant increase, correct?
Great question, Noah. And I do want to double check. It's always good to have eyes on those data sets. So let me double check on that and then confirm for you. Without having looked at it directly, there's a couple of things that it could be attributed to. One is the reporting timeline and the number, how they're reporting those cases as well. So let me just get back to you on that. I'll try and do that by the end of the day today.
No worries. Thank you. I just thought I'd ask. And because then my next question, I was just going to ask Michael, is I know we expanded the mask policy at MSU to not just classrooms, to all sorts of the indoor spaces at MSU. Is there anything else that the MSU campus is looking at to help combat this maybe even more?
Thanks, Noah. We are really strongly urging everyone on our campus community to get vaccinated against COVID-19. We make those vaccines available through university health partners for our students, faculty, and staff by appointment. All they have to do is go to our COVID website and get an appointment for themselves. We're also still maintaining our student vaccination sweepstakes, which is an incentive plan to get our students their vaccines. And we've seen really strong turnout for that. The numbers keep going up of the folks who are in that vaccine sweepstakes, more than 4,300 currently. And of course, while we require masks in certain indoor spaces, we of course recommend them everywhere people are willing to wear them. So the more we can do to get people vaccinated, though, is really the key thing, and we push that hard.
Okay, perfect. Thank you. And yeah, Lori, I'll send those to you, those numbers from the two reports or something. But other than that, that's all I got. Thanks.
Thank you, Noah. That would be really helpful. Can send them to Holly as well. Any other questions? Olivia, go for it.
Okay, hi, yeah, Olivia with Yellowstone Public Radio. I have a couple questions for Lori. I was wondering if you could pull back up that slide on the COVID numbers and then masks versus no masks. I had a couple questions on that.
Yes, let me just pull that up. I added in a second screen, and it always makes it a little bit challenging. Where is that? Sorry, Olivia.
Yeah, if it's being funky, I can just ask my question and maybe you can answer without the.
Yeah, let me. I don't know why it's not working.
Yeah, I was just wondering, so it sounded like you were tracking no mask versus masks and looking at the policies that started at the beginning of the school year. Okay, oh sweet, nice. Okay.
Oh. That's probably painful for everyone. All right.
Okay. Yeah, so you had said yeah, so you had said that you're tracking what their mask policy was at the beginning of the school year. I've noticed some school years have changed their mask policy as the year has gone on. One school I talked to, it was like their enrollment was like 600. So I was just wondering, I know it might be hard to track the changes, but how that factors into your data.
Yes, so we just did it from the start of the school year. It just seemed as an easier data set to start with. And we're going to continue to look at those data to continue to monitor that. And one thing I should have said, and Holly, I don't know if you have those up, but our data that was reflected locally is also supported by 2 new MMWR reports. Holly, can you pop those in the chat when you get a second? That basically kind of really kind of explains the same correlation that we're finding as well. So for those who are just wanting to dig into that data a little bit more on a national level, and some of the reports that the CDC is looking at, I wanted to make sure you guys had that available.
So if they change their mask policy, that won't necessarily get updated in the data that you're looking at right now. Is that right?
Right now, we're going to continue to look at that data set, but as of right now, we're starting it with those schools that have started the school year off without a mask policy, because you're correct. There are schools who implemented a policy later on, but just to kind of create some controls, we wanted to just kind of keep it simple with starting with those schools that did not start, or those schools that did start with a mask policy.
Okay, yeah, thank you. And yeah, thanks for putting together that data. That's super helpful.
Yeah, absolutely.
Yeah, and then I just had a question on, so given, kind of the higher number of cases that you're seeing in schools, I just wanted to ask you, Lori, yeah, how contract tracing is going with the schools. Just wondering from a staffing perspective, if you feel like you have enough staff to do that with the loads that you have right now, and just thoughts on how that's going.
Yeah, thank you for that question. It continues to be a challenge. As we discussed in some previous calls, we have prioritized our case investigations, not only just with those who have tested positive, but also those who are close contacts. And those have included those institutional settings in the school K through 12 settings. And MSU, excuse me. So for us, we're going to continue to evaluate our processes so that we can continue to identify connect with those positive cases as quickly as possible. We're facing a lot of the same staffing challenges. So we're trying to onboard as many staff as we can and continue to look at ways to streamline our process so that we can be really responsive to our community. So I would guess my short answer is, of course, we could use some more staff support to assist with that. And we're also looking at other streamlined processes to help make sure we can be responsive to our community.
Okay. Yeah, I guess how many more staff are you wanting to have to kind of get you to where you'd want to be on that?
That's a hard number that we've tried to figure out. It's a magic number. Right now, we have 4 to 7 individuals who we have on a daily basis, but we certainly could use more to support that work.
Okay, and sorry, just one more question. Are you using any federal dollars to hire more staff at this time on the contact tracing?
When you say federal, do you mean ARPA, funds available through ARPA? Yes, we are.
Okay, great. Thank you.
Yeah, great questions. Thank you. Any other questions out there? And I'm sorry that I was struggling with my screen share, Olivia. What we'll do is we'll send those 2 PowerPoint slides that I shared with our update and the link to this recording. So I apologize for that. I'm not really sure what was going on today.
All good. Well, are those going to be in the weekly reports now, or is that like something you were just doing for this one?
I was highlighting it specifically for this particular press call.
Okay, thank you.
Other questions out there? Hi, John. Hope you're on mute.
Whoops, my bad. My name is John and I'm reporting up from Big Sky, and I was just hoping to talk base with Kallie real quick. I noticed that there are no hospitalized patients currently at BSMC with COVID-19. I was just curious how this 100% capacity impacts BSMC at all, and if you have any plans to incorporate them because they have ventilators, or if that's still not something that y'all consider.
Sure. So that's a really good question, John, because there are beds available. However, there's a particular level of care that isn't available. So we can't send critical care patients to Big Sky Medical Center. They do have 1 transport ventilator, but that would be used in an emergency situation to get an airway stabilized so that they could make their way to a higher level of care. So how we would partner with Big Sky Medical Center from a Deaconess Hospital perspective is, we definitely accept patients from Big Sky Medical Center to Deaconess if they need to be taken to a higher level of care, and would make accommodations for that even in 100% capacity as best as we could. We're hoping to use Big Sky Medical Center at some point as a swing bed hospital, although they haven't technically become a swing bed hospital yet. That would be that post-acute care bed that we would send patients to get them out of the acute care setting. And we're working very as fast as we can to get the appropriate staff in place up there. Physical therapy, occupational therapy, nutrition services, and a higher amount of staff so that we can use it as a swing bed location, and other hospitals throughout the state can use it as a swing bed location. It's just not set up for that yet. So the way that Big Sky Medical Center will be used right now is just for patients who present there and can remain there according to the level of care that's required for them, can stay there as a critical access hospital. For our capacity at Deaconess Hospital, there are a number of other critical access hospitals throughout the state that we can use as swing beds for post-acute care that we can shift our patients to if needed. And we're collaborating with a lot of those hospital leaders right now to keep a pulse every day on where that availability is so that we can shift those patients. Now, something that we have, sorry, I'm giving you a lot of information. Do you want me to pause or do you want me to keep going? Okay, so we have a number of waivers in place. The governor added, which was so nice, added some swing bed waiver language to already existing waivers that we're using so that we can send patients to swing beds that are further away than we normally would. So looking at Montana and Wyoming as options all over Montana and into Wyoming to send our patients to open up more acute beds if needed. So something we continually are evaluating and looking at, and we are working towards taking advantage of that additional waiver to allow us to send patients once they're finished with their acute care and it's safe to do so, moving them to a more appropriate level of care, post-acute care, wherever that may be. But Big Sky is not currently set up to be a technical swing bed at this time, but we are actively working on that.
Is just to follow up, are y'all currently, I may have missed this, but is Deaconess currently on divert?
Good question. That changes moment to moment. So I'm not going to say that we're on divert right now, but you know, we would be, and we, you know, if we didn't have the bed right now, the information I gave you was from 6 o'clock this morning, so it likely has changed as our physicians have discharged patients, and as we've kind of moved through the plans of care for the patients who are occupying all of our ICU and medical beds. I don't know if we are currently actively on divert.
And the
But
last,
that does change moment to moment. Yeah.
thank you. The last question I have for you is, and maybe I missed this as well, I came in a few minutes late, but looking at the numbers, so Deaconess is at 100% capacity across the board. Is there a threshold for Bozeman Health in terms of moving into crisis standards of care in terms of numbers, because y'all are already at 100%? Are you, yeah, what is that? Is there a threshold you're waiting for?
Yeah, it's a great question. And so there's a way that the state of Montana looks at resource scarcity and bed capacity and management of that. There's a document out there from DPHHS, Montana DPHHS, that's called Resource Scarcity Management and Crisis Care. And it's a guidance for us. And what we've done is we've adopted that, and we have created internal work processes and operations so that we have those triggers of when do we move from conventional, which is normal standards of care, into that middle layer of contingency. And contingency really is you're not in crisis standards of care yet, but you have personnel delivering care in atypical clinical spaces. So we would have, you know, we would start prioritizing who our hospitalists and our intensivists started taking care of. And we would work with other specialists throughout the organization to have them admit their own patients and rely upon the intensivists and the hospitalists less, so that they could care for, you know, other types of patients, the COVID patients perhaps. And what we would start doing in that contingency mode is we would start providing care in our new converted unit, our other patient care unit that we recently created in our old nursery space. So that would be a contingency unit that we would start using. And to my knowledge, we aren't using it today. But that would be a contingency strategy. We've set it up as a clinical unit, but it's a non-licensed bed area, and it's an atypical unit for acute care, although it is clinical and has the right equipment, and they would see the same types of doctors and level of care that they would in any other clinical unit. Now, to move into crisis standards of care, we will have had to have used all of those atypical clinical spaces. So our post-acute care unit, our pre-op area, all of our other procedural areas where we clinically see patients. And we would have to start putting them in to move into crisis standards of care. That would mean that we were having to use hallways and conference rooms and waiting areas that do not ever see clinical patients from a typical standpoint. And so we would go through all of those contingency pieces before we would be in crisis standards of care. And we are not currently using those contingency strategies at this point. So there's a buffer, if you can see that.
Thanks, Kallie. I appreciate it.
Yep.
Other questions out there today? We've given you a lot of information.
Ooh, I actually have one more, Kallie. Do you know if the Pfizer booster will be offered at Big Sky Medical Center?
I was hoping you would ask that. We don't have immediate plans for Monday for Big Sky. Anyone who meets that criteria can discuss that in their scheduling with their primary care provider. Right now they could, but as far as massive immunization events go, that is still in the works, and we will make announcements when it's available, not if it's available up there, but when it's available, which should be in the coming days. So we'll absolutely make those massive events available up in Big Sky. We just don't have the exact dates determined yet, but actively working on that. But if people are in Bozeman and they want to receive it from anywhere in the county, they can come and receive that. Monday, they can sign up for appointments in Bozeman, and then they can talk to their primary care provider in Big Sky to see if that can be available during their regularly scheduled appointment.
Do y'all have the workforce and staffing to support another massive vaccination campaign?
I mean, no, but yes, we will absolutely make sure that we have that we shift our resources to accommodate that, because we know how important it is. Having over 400 positions open in our health system means that we don't have enough staff in general anywhere, but we know how important this is. And so we are absolutely redistributing our resources from other areas to ensure that, that we have that.
Is it best to go through Bozeman Health or the county in terms of helping out with the vaccination if someone's looking for work?
I don't know. I mean, we absolutely, yeah. I think, what's that?
Both will be offering the booster.
So I think John may have missed the first part of the conversation, Kallie, so I may just jump in a little bit. So John, we are partnering the Gallatin City County Health Department, and your question about staffing resources is one of the big reasons why we wanted to make sure we could support the community's need and demand for a booster. So we wanted to make sure we pooled our resources, worked collectively in partnership so we could meet that demand for services, knowing that we too have to redistribute, and we absolutely will as needed to support this effort. And so we are collaborating together to hold those mass vaccination clinics at the Bozeman Health campus starting next week. Kallie, did I summarize kind of the beginning of your statement?
Yep,
accurately?
so, yeah, absolutely. So we are working with the Gallatin City County Health Department to use their personnel and combine efforts that's part of that resource redistribution for the benefit of the whole community that we're doing right now.
Absolutely.
Thank you. Appreciate it. Sorry I missed that.
That's
No
okay.
problem.
I also wanted to add to we'll be working in partnership as we have in the past with our community partners down in West Yellowstone. There's nothing certain in terms of dates at this time, but I do want to make sure that that information is available as well. Stay tuned for more information about possible clinics down in the community of West Yellowstone. I also wanted to reiterate, as Kallie mentioned too, especially within the Bozeman Health System and other providers may be able to provide those vaccines in clinic. So do reach out to your provider in that sense as well. Also, there are one good resource to continue to look at is Vaccine Finder. And Holly, if you could pop that into the chat again as well, that would be great. That resource is going to be up on our website as well, so that individuals can look for other locations, including pharmacies. One thing that I'll stress is that, as you can imagine, this information is very new. We're kind of spinning up as quickly as we possibly can. So do give a little bit of patience to those pharmacies and other locations who are needing to set their workflows in place as well. But I do want to stress that we are hearing from our state partners that, and even at the national level, that there are no current supply concerns as it relates to vaccines. And we will continue to offer those appointments available so that there's opportunities throughout the community and throughout the coming weeks to be able to get an appointment. So be patient, we have vaccine, and those appointments will become available soon.
And also just a quick reminder as well, if any Bozeman Health patient has a regularly scheduled visit coming up, they can absolutely receive that booster dose. Remember, this is only for Pfizer, those who have completed the Pfizer regimen. They can ask to have that incorporated into their upcoming clinic visit. And that goes for any Bozeman Health site. So for their primary care provider visits, they can have that added on. And so they'll want to just call ahead and let them know. And then also, just speaking to the Big Sky question from John, we do have a number of walk-in appointments as well. So especially in the Big Sky community, they can walk in and request that as well. So, but it's always good to call our vaccine and our COVID hotline to get some more information about that if needed. Go to our website, and we'll be putting out a lot more communication about additional upcoming events. But we'll start those vaccine administration massive clinics at Deaconess starting Monday. They will go all throughout the week. And then we will continue the following week as well.
Thanks, Kallie. Any other questions out there? No.
Michael, I thought I'd ask you one more question just about MSU stuff, because I haven't heard about it in a while. The quarantine and isolation housing. Do you have numbers on that, or do you know if it was being used and filled up? I just thought I'd just ask you for a general update on that.
We maintain quarantine and isolation housing for our on-campus students. And so far, our preparations are meeting with our needs, and we are able to house all the students who need that service.
Thank you.
Okay, other questions out there? Okay. Great. Well, with that, thank you so much for joining us today. We appreciate your reporting. We appreciate your partnership. I also appreciate your patience. I know we're not as able to quickly respond to some of your requests, and so we really do appreciate you joining on these press calls. Please note that it's not because we don't want to speak with you. We certainly just are, as you've heard, we have a lot that we're planning for. So thank you again for your patience. It really is helpful to have that understanding and patience in our community for our efforts as well. And I really, again, want to say thank you to Kallie and Michael for joining. it really is an honor to be able to work with these partners to respond to the COVID-19 pandemic. And we'll continue to work collaboratively together. So thank you so much. And I hope you guys all have a good rest of your day. Take care.
Thank
Thanks,
you.
y'all. Appreciate it.